If you've just tested positive for COVID-19, and you have common risk factors for serious illness, there are now ample treatments available, generally at little or no cost, that could help you avoid the worst and recover more quickly from a mild or moderate case of COVID. Paxlovid, a 5-day course of pills from Pfizer, is at the top of the list of recommended treatments. Studies from the drugmaker showed that, in unvaccinated people at risk of serious COVID medical risk factors, Paxlovid was nearly 90% effective at cutting the risks of getting hospitalized or dying because of COVID. People who are vaccinated or who have recovered from COVID could still benefit from the drug, says Dr. Priya Nori, an infectious disease physician at Montefiore Health System in Bronx, New York, and a professor at Albert Einstein College of Medicine. Taking Paxlovid could help you get back on your feet faster, feel better faster, and be potentially less infectious faster, Nori says. The Biden administration has been talking up the treatment. We want all individuals to know about this effective medication, and to have a conversation with their healthcare provider about if they are eligible, and whether they should be making a plan for accessing the drug if they do test positive, says Dr. Meg Sullivan, Chief Medical Officer for the OFF. But some people have had trouble getting the medicine quickly, when it can make a difference in the progression of the disease, despite the administration's effort to make the medicines easy to obtain after a positive test for COVID-19. Dan Weissman, 54, tried 3 different routes to access Paxlovid in the Chicago area when he got COVID in April. First, the nearby CVS Minute Clinic didn't have any appointments readily available. Then, the nurse practitioner at the urgent care clinic he went to initially misunderstood his medical conditions and refused to prescribe the pills. Eventually, his wife tracked down his recently retired primary care doctor, who wrote him a prescription. Weissman is glad he got the pills, his condition improved after taking them. But he says it took an unusual amount of knowledge, connections and assertiveness, to obtain them. Luckily, Weissman, host of the health podcast An Arm and a Leg, had all 3. In upstate New York, after a few days of COVID symptoms, Pamela Coukos' college-age son tested positive on a recent Friday. He has one of the risk factors, he seemed pretty sick. And also, it would be better if he didn't spend, 10 days feeling terrible because he was in the middle of final exams, Coukos says. But the university health service was closing, and the nearest test-to-treat location wasn't open on weekends,